Hello, we are the Fluorescent Seeders group consisting of Nias Almir, myself, Maya Bakhta, and Laban Gulid. We are presenting our senior design project for biomedical engineering titled Multimodal Breast Tumor Localization Seed. Our breast tumor localization seed is designed to be used by surgeons before conducting breast tumor removal or breast tumor biopsy. The current method that's applied across medical professions right now, the most popular is the needle or wire breast tumor localization. This is an uncomfortable process for the patients and can only be done a few hours before the procedure. Our device being designed is similar to the Savvy Scout that's located at the bottom of our background page, and that method involves no wire that can be dislocated. It's a very small device that can be detected on the outside using a probe. However, that method, the Savvy Scout method, is very expensive. So we are designing a method which is similar to that, insertion of a small seed that can be inserted up to weeks prior to surgery and does not have that cost associated with it. So for our seed fabrication, we chose a silicone seed which is going to be hollow on the inside. The silicone was selected because it is FDA approved and it is optically transparent so that it can be imaged using the three imaging modalities that we're aiming to image it with. Three imaging modalities being X-ray, ultrasound, and ultrasound switchable fluorescence. The ultrasound switchable fluorescence relies on the optically active fluorescent contrast, which is going to be present as nanoparticles contained within the seed. So the hollowing that we are creating using our molded silicon is going to allow us to contain this nanoparticle suspension within the seed. Our hollowing and the seed itself were molded or cast using ABS molds that are described over here in Figure 4. Figure 4 shows a few different iterations of the mold that were used to produce the seed, with mold number 3, the ones that are shown in green, being the ones that produced the best seed hollowing. We had issues with seed removal in molds 1 and 2. The seed shown in Figure 3 is what it looks like with the hollowing, and that's the seed that we're able to fill nanoparticle suspension into and then cap it off with more silicon so that it isn't enclosed inside. The nanoparticle suspension is slightly cytotoxic, which is why we do not want it to leak out once implanted into a patient's body. The hollow seeds will then be used, the hollow seeds once filled up with nanoparticle suspensions will then be scanned using the different imaging modalities, and then we are going to move on to tests to describe what these tests are going to look like. First of all, for functionality tests, since our seed is meant to be imaged using the three imaging modalities, we want to see how effective they are at doing so. So in image A in Figure 5, that shows the ultrasound setup. There's a computer system and then the ultrasound probe. B shows the CT scan that will be used, and C shows the USF setup for the ultrasound switchable fluorescence. In order to prepare the seed for these imaging tests, we will insert the seed into a chicken breast tissue as shown in Figure D. This will be done in a small sample so that we can image it in an actual tissue sample, as the imaging in real life will be done on patient breast tissue. Image D also shows how we will prepare the tissue sample for testing stability. In order to do that, we will insert the seed into the tissue as shown and place it on a rocker. The seed is meant to be stable and not dislodge and move into a different position, even with movement, since patients will be moving and walking around between time of insertion of the seed and actual surgery. The seed is designed to be surgically removed once it does come out, and since we mentioned that it should be leak proof, we also conducted a leak test as shown in E, whereby the seed, in this case we filled it with trypan blue for better visibility, was inserted into a beaker of water. We did not notice any leakage because there was no trypan blue leakage or any water that went inside the seed. Our seed is, the sizes are shown in our results, and we did a preliminary CT scan. The results are shown over here. The seed has a very small standard deviation, so they are very consistent in size, and the size within the range of 3 to 5 millimeters. They're actually 4 millimeters in length and 2 millimeters wide. It's a little bit under 2. That's perfect for delivery. In conclusion, we were successfully able to fabricate the seeds, contain the nanoparticle suspension needed, and we have the desired size of a biocompatible seed. We will be conducting the further testing. We haven't done all our tests yet in order to see its functionality. fully. Thank you.